Hello friends, welcome back to my channel. First question, a important precautions while administering live viral vaccine is to have available option A, antiviral drug, option B, plasma expander, option C, glucose solution, option D, epinephrine solution. Right answer is option D. Diagnostic diphtheria toxins, option A, is used to sink test, option B, is injected intradermally in an amount equivalent to IMLD dose in a guinea pig, option C, is injected intramuscularly, option D, is 1.0 cc in a dose. Right answer is option A. Diagnostic diphtheria toxin is used to in sink test. Which one of these is antiviral drug? Option A, novabiocin, option B, vidrabin, option C, bacitracin, option D, polymyxin. Right answer is option B. Novabiocin is an antibiotic that was discovered in 1950 and still used in veterinary medicine and research. And bacitracin is a topical antibiotic ointment that used to treat minor skin injury and bacterial skin infections. And polymyxins we can use to treat variety of infections, species urinary tract infections. Next question. Yellow fever vaccines. Option A is a suspension in water for injection. Option B is suspension of a killed strain of yellow fever virus. Option C is suspension of attenuated strain of yellow fever virus. Option D, impart immunity which lasts for less than 1 year. Right answer is option D, impart immunity which lasts for less than 1 year. Next question. Smallpox vaccine. Option A is obtained from vaccinated horses. Option B is prepared by making a glycerol water suspension of vesicles of vaccine or cowpox. Option C is not stable in frozen state. Option D, in injected intramuscularly. Smallpox vaccine is prepared by making a glycerol water suspension of vesicles of vaccina or cowpox. Correct answer is option B. Rabies virus is attenuated by option A, drying, option B, dilution, option C, emulsification with phenol, option D, all of the above. Right answer is option C, emulsification with phenol. Live vaccines are not used in the country for immunization against option A, diphtheria, option B, measles, option C, polymyelitis, option D, smallpox. Correct answer is option A, diphtheria. Live vaccines are not used in the country for immunization against diphtheria. Rubella is another name for option A, measles, option B, meningitis, option C, German measles, option D, scarlet fever. Correct answer is option C, German measles. The antitoxic effect of tetanus antitoxic lasts option A 4 to 6 hours, option B 24 hours, option C 10 days, option D 2 to 3 years. Correct answer is option C, 10 days. Next question. Its symptoms of tetanus appear the antitoxin should orally, option C, be given intramuscularly, option D, be given intravenously or intraspinally. Correct answer is option D, to be given intravenously and or intraspinally. Next question. Which of the fraction of blood is associated with antitoxins? Option A, pseudoglobulin, option B, albumin, option C, leukocytes, option D, fibrinogen. Correct answer is option A, pseudoglobulin. Next question. A common complaint after vaccination with live rubella virus vaccine is option A, rash, option B, sore throats, option C, joint pain, option D, neuritis. Correct answer is option C, joint pain. In order to kill spores, option A, autoclave for 15 to 20 minutes at 1 to 20 degrees Celsius. Option B, steam the medium for 15 to 20 minutes. Option C, rise temperature slowly to 90 degrees Celsius and maintain this temperature for 1 hour. Option D, heat 15 to 30 minutes at 100 degrees Celsius in moist list on 3 successive days. Correct answer is option D. Heat 15 to 30 minutes at 100 degrees Celsius in moist list on 3 successive days. Next question. Which one of these is similar to the cephalosporin? Option A, doxycycline. Option B, minocycline. Option C, carbonicillin. Option D, monolactam. Correct answer is option D, monolactam. Next question. Most food poisoning is caused by species of option A, typhus. Option B, salmonella. Option C, Cghs. Option D, tetanus. Correct answer is option B. Next question. Which of the following are most effective in treating rickets infections generally? Option A, penicillin. Option B, tetracycline. Option C, aminoglycosides. Option D, sulfonamide. Correct answer is option B, tetracycline. Next question. In the course of an attack of dysentery, the organism is best recovered from option A, the blood. In the course of an attack of dysentery, the organism is best recovered from option A, the blood taken at the peak of fever. Option B, biopsy of rectal mucosa. Option C, the stool mucus. Option D, the urine. And option E, the saliva. Correct answer is option C, the stool mucus. Next question. Which of the following is not a classification of virus? Option A, dermatotrophic. Option B, neurotrophic. Option C, somatotrophic. Option D, neuroplastic. Correct answer is option D, neoplastic. Which one of these not produced by molds? Option A, penicillin. Option B, terramycin. Option C, streptomycin. Option D, bacillin. Option E, neomycin. Correct answer is option D, bacillin. Penicillin is an antibiotic used to treat bacterial infection, and penicillin G and penicillin V and amoxicillin or ampicillins are these type of penicillin. And penicillin G and penicillin V, difference between the penicillin G and penicillin V is penicillin V is taken orally and penicillin G is given intravenously or intramuscularly. Okay, and streptomycin is the first discovered aminoglycoside antibiotics. Next question. Yellow fever is option A, transmitted by body and head loss. Option B, found mainly in temperate climate. Option C, capable of causing a viral disease in epidemic populations. Option D, transmitted by the female. Correct answer is option C, capable of causing viral disease in epidemic populations. Next question. Active immunizations against diphtheria may be developed by injection with option A, alum precipitated culture. Option B, antitoxins. Option C, antidiphtheric serum. Option D, toxoid. Correct answer is option D, toxoid. Next question. Passive immunity is the result of option A, injection with specific antigen. Option B, injection with a specific antibody. Option C, a lack of response to the antigen. Option D, partial immunizations. Option E, recovery from a specific injection. Correct answer is option B, injection with a specific antibody. Next question. Immunization against measles usually employ option A, measles toxoid. Option B, a gamma globulin. Option C, a live virus. Option D, a live bacteria. Correct answer is option B. Next question. Influenza vaccine seldom produce hypersensitivity because they are option A not prepared in egg, option B mixed with preservatives, option C given in such low dose, option D highly purified. Correct answer is option D highly purified. Influenza vaccines seldom produce hypersensitivity because they are highly purified. Next question. Thermal death point take place when option A all bacteria of a given species are killed after 10 minutes exposure, option B all bacteria of given species are killed after 20-minute exposure, option C all bacteria are killed instantaneously, option D half of virulent organisms are killed. Correct answer is option A. All bacteria of a given species are killed after 10 minutes exposure. Next question. Autogenous vaccines are option A. Vaccine prepared from autotrophic bacteria. Option B. Prepared from autolytic organism. Option C. Prepared from patient own organism. And option D. Identically with stock vaccine. Correct answer is option B. Autogenous vaccines are prepared from autolytic organisms. Next question. Bacterial antigens. Option A are vector of disease. Option B are antibiotic substances. Option C are used to produce active immunity. And option D never produce disease. Correct answer is option C. Bacterial antigens are used to produce active immunity. Next question. Gas gangrene is commonly used. Option A Pasteurella, option B Mycobacteria, option C Clostridia, option D Salega. Correct answer is option C. Next question. The organism causing urinary tract infection is option A E. coli, Escherichia coli, option B Proteus vulgaris, option C Pseudomonas aeruginosa, option D Staphylococcus pyogenes, option E all of the above. Correct answer is option E all of the above. Next question. The mechanism of dry heat sterilization is primarily option A oxidation, option B reduction, option C coagulation, option D denaturations, option E none of the above. Correct answer is option A. The mechanism of dry heat sterilization is primarily oxidation. Bacillary which of the following organism? Option A Pasteurella, option B E. coli, option C Salega, option D Plasmodium. Correct answer is option B E. coli, Escherichia coli. Next question. The preferred method of sterilization for mineral oil is option A autoclaving, option B filtration, option C gaseous sterilization, option D dry heat. Correct answer is option D dry heat. Next question. Bacteriophages are usually option A bacteria, option B virus, option C lipoidal, option D polysaccharides. Correct answer is option virus. Bacteriophages are usually virus. Next question. Rocky Mountain spotted fever is caused by option A viruses, option B Rickettsia, option C a bacteria, option D a amoeba, option E none of the above. Rocky Mountain spotted fever is caused by a Rickettsia, option B. Next question. Which of the following organism is capable of devitalizing living tissue in gas gangrenes? Option A Clostridium welchi, option B Clostridium novi, option C Clostridium specticum, option D Sponginis. Correct answer is option A. Next question. The function of antibodies in immunity is option A to neutralize toxins, option B entirely bacteriostatic, option C to produce more leukocytes, and option D to build up resistance against any infection. Correct answer is option A to neutralize toxins. Next question. The most common location of the organism in typhoid fever is option A, nasopharynx, option B, gallbladder, option C, fallopian tubes, option D, misprint, again gallbladder. Correct answer is option B, gallbladder. The most common location of organism in typhoid fever is option A, nasopharynx, option B, gallbladder, option C, fallopian tube. Correct answer is option B, gallbladder. Next question. Passive immunity usually gives which of the following protections to the patients? Option A, complete, option B, long term, option C, short term, option D, undetermined. Correct answer is option C, short term. Next question. Anaphylactic reaction is an indication of option A, no antibody present in blood, option B, immunity, option C, hypersensitivity to given protein, option D, presence of typhoid bacilli. Correct answer is option C, hypersensitivity to given protein. Next question. The mode of spread of botulinum toxins in the body is by option A, direct extensions along nerve trunks, option B, bloodstream spread, option C, lymphatic spread, option D, all of the above. Correct answer is bloodstream spread, option B. Next question. The sterilization temperature for aqueous solution in autoclave is option A, 18 degree, option B, 121 degree, option C, 150 degree, option D, 160 degree. Correct answer is the sterilization temperature for aqueous solution in autoclave is 121 degree. Next question. The Mantox test uses option A, all tuberculosis, and option B, diphtheria toxins, and option C, serum antigens, option D, polysaccharide antigens. Tuberculosis. Correct answer is all tuberculosis. Next question. A highly sensitive semi-quantitative method of detecting microbial antigens in microbiological fluid is done by option A, radioimmunoelectrophoresis, option B, counter-immunoelectrophoresis, option C, HPLC, option D, freeze-dried centrifugal method. Correct answer is option A, radioimmunoelectrophoresis. Thanks for watching this video. If you like this video, please do subscribe and wait for my new upcoming video.